sehat. Selama lebih dari 1 tahun terakhir, kita telah menjalani aktivitas dengan keterbatasan dan kewaspadaan karena adanya virus corona atau COVID-19. Vaksin COVID-19 memang sudah ada di Indonesia. Namun jarak vaksinasi pertama dan kedua yang cukup jauh membuat orang beresiko terkena COVID-19 karena imun tubuh belum terbangun. Vaksinasi harus diulang dalam 3 bulan setelah vaksin pertama. Oleh karena itu, menjaga daya tahan tubuh menjadi sangat penting untuk melawan virus dan bakteri penyebab penyakit.
Banyak yang bertanya kepada saya tentang Rhea Helton. Apakah Rhea Helton itu obat untuk COVID atau bukan? Saya terus terang tidak bisa menjawab karena saya bukan ahli di bidang ini. Tapi yang jelas Rhea Helton adalah suplemen kesehatan dan sekarang lagi dilakukan clinical trial yang mungkin dalam waktu dekat ini akan selesai karena proses clinical trial itu memang lama untuk membuktikan bahwa Rhea Helton itu bisa dipakai untuk pencegahan COVID atau untuk treatment COVID. Karena memang juga banyak testimoni yang mengatakan bahwa mereka terbantu dengan Rhea Helton baik untuk pencegahan maupun pengobatan. Tapi lagi-lagi izinnya Rhea Helton itu sampai saat ini hanya sebagai suplemen kesehatan. Nah, untuk menjawab pertanyaan lebih pasti pada kesempatan kali ini saya undang Dr. Haik Babikian, salah satu saintis yang ikut memformulasikan Rhea Helton yang sudah dirasakan manfaatnya oleh banyak dari masyarakat Indonesia, dan kita mungkin bisa tanyakan juga ke beliau nanti apakah Rhea Helton itu untuk COVID atau bukan, atau sebetulnya Rhea Helton itu untuk apa gitu. Karena selama ini orang banyak mempersepsikan atau menggunakan Rhea Helton untuk pencegahan dan pengobatan COVID-19. Saya perkenalkan tamu saya kali ini, Dr. Haik Babikian. Hi, Dr. Haik.
Hello.
How are you?
I'm good, thank you.
I heard you just came from Armenia.
Yes, sir.
How long have you been there?
I spent around 2 months.
2 months?
Yes.
And then you came back here, you have to go quarantine for
7 nights, 8 days.
7 nights, 8 days. Okay, that's a rule.
Yes, of course.
You and your family has been vaccinated, so everything should be okay.
Of course.
And of course you consume Rhea Helton also.
Every day.
Dr. Haik, a lot of people asking me if Rhea Helton is the supplement for preventing and treatment COVID or just supplement for well-being.
Thank you, first of all, for hosting me here. Second, this is a very interesting question because it comes to the core of Rhea Helton. Helton, in the beginning, it was designed to be a supplement to improve your health, to improve your immune system, to improve your general well-being.
Okay.
It has fantastic properties like antioxidant, anti-free radical, which are very important for the well-being of your body. Because what free radicals do in your body, it tends to destroy your cells, to cause cell aging, and with that it brings other complications, whether it's the cardiovascular system or for the general body. What happens that Helton, with its component as an essential oil, as active ingredients, with the olive oil as a carrier oil, it has the ability to be as a free radical scavenger. It takes out the free radicals from the body. And with that, it protects the body and also it improves the immune system.
So this is not chemical. This is basically all natural
Yes.
oil.
So it's 99% is olive oil and 1% is 5 essential oils, which has anti-inflammatory benefit, antioxidant benefit, improving the immune system, making your body fight against diseases. So it wasn't designed for COVID-19.
Why we need anti-inflammatory? Why we need antioxidant? What they do to our body actually, Dr. Haik?
Because oxidative stress is an ongoing process in your body. Inflammation is an ongoing chronic problem that runs in our body, and it because of the inflammation and because of the oxidative stress and the free radicals, we have our aging of the body, and the longer it goes, it accelerates more, and it will cause vascular damage. It will cause damage to different organs. So consuming in general supplements that has antioxidant and anti-free radical properties, it helps the body to resist this aging. So that's for example, when you consume vitamin E, vitamin C, health tone, what it does actually, it helps the body to slow or stop the process of the cellular aging and the damage that will be caused by the inflammation and the free radicals. So that's the importance of health tone to be part of your daily diet, is for you to stop this effect of the free radicals and the inflammatory process that happens in our body. So that's why we take supplements to assist our body to be saved from the damages of these components, factors.
And I read some article that, is it true in the study, in the trial, that ReaHealthTone also helping us to less likely to get cancer because of the high antioxidant content?
Yes, Paiko. One of the research that we did, it was the anti-carcinogenic effect of health tone,
which is already here.
Already here. So what it showed that in a controlled study, it showed that it suppresses the tumor index factor, and it showed that it slows the creation of new tumor or new cancer. And that's what we need, because in our daily life, even the oxidative stress, the pollution, some foods that we consume, they have carcinogenic effect. So health tone also will help to suppress these processes and protect our body.
And there is some study also I read in some journal about ReaHealthTone. This supplement also help us to prevent us from getting like cardiovascular blockage or something like that.
It's not per se cardiovascular blockage,
okay.
But the study showed that because of its antioxidant effect, and it has anti-free radical effect. So these free radicals, what they do, as I mentioned, they tend to harm our vascular system.
Okay.
And the first target of these pro-oxidant and these free radicals is to damage our cells and vessels. So when you get health tone, and with the help of health tone as an antioxidant and as anti-free radical, it will maintain a better cellular complexity. It will maintain a better vascular system, and that's why we get this positive effect on the vascular system.
Okay. And then a lot of testimony said that after they consume ReaHealthTone, it helped to faster the recovery process after they get COVID. Even some of them believe in the testimony that by consuming ReaHealthTone, they're more confident under the pandemic like this, in order not to get infected with the COVID. What do you think about that?
Actually, Paiko, I want to see HealthTone as a different supplement that you see in the market.
Okay.
Because after seeing the health benefit of HealthTone through testimonials from a lot of people around us, from thousands of people, we went one step ahead to see what can HealthTone do. So we got into 2 clinical trials. One is in Persahabatan Hospital with Dr. Irina Burhan to prevent and to see the protective effects of HealthTone in COVID. And the other one is with Rumah Sakit Hasan Sadikin and in Bandung and with Miswa Atlet to treat mild to moderate COVID-19 patients. On top of that, we did research with the University of Texas Medical Branch to see the in vitro effect in the labs on the SARS-CoV-2 virus actually. And in 2 different separate trials, they found that the oils of HealthStone actually can stop the replication of the virus and can kill the virus in the in vitro situation.
In vitro meaning in the lab.
In the lab. And that what we saw also, it was translated at least in the interim analysis in the Wisma Atlet trial. With the interim analysis, it showed that the time of hospitalization was reduced by 2 days in the HealthStone group. And also the conversion from positive to negative was faster in the group of HealthStone. So there's an enzyme called RNA-dependent RNA polymerase. And in our in silico model, it's a software that predicts what happens between the, let's say, the supplement and the virus. It shows that HealthStone has component to block this enzyme, the RNA-dependent RNA polymerase, and consequently it will stop the COVID-19 virus to replicate, the SARS-CoV-2 virus. So that's one of the effects that HealthStone can do to make the COVID patient recover faster. The second thing, HealthStone has an anti-inflammatory benefit, which is translated to the effect on the interleukin 6, interleukin 2, TNF-alpha.
What is interleukin 6,
interleukin 6, they are cytokines in our body that promote inflammatory process. In the beginning, they are useful because they let the body fight against the disease.
Right.
But later on, they get to be out of control because of the SARS-CoV-2 virus, and the body start to attack the lungs and cause the worst progression of the disease, which will cause the cytokine storm, and eventually the lungs will collapse. So HealthStone has excellent effect on these inflammatory parameters and cytokines.
It's preventing the cytokine storm also.
Exactly, and that's what we see, that if you start early on HealthStone, it's unlikely for you to progress to a worse condition. So if you started on mild, you remain mild patient, and even the recovery process will be faster. And even we have testimonial that the sleeping pattern of the patient gets better in the first 2 days. And that comes because we relieve the stress because we have the anti-inflammatory effect. So the patient feels better even by breathing better. So that will give a better sleeping pattern, which is very important for the recovery of the patient.
So for the well-being, what is the dose that we should consume the ReaHealthTone?
So for the general well-being, 1 ml once daily.
1 ml is like 1 full pipette. Let me open this.
Okay.
1 ml is like this. Yeah, there is a meter here that said that this is 1 ml.
Yes.
So 1 ml, 1 time or 2 times a day?
For general prevention, it's 1 time once daily.
Okay.
If you are feeling that you might get sick, you're feeling unwell, you're feeling extra exhausted, tired, you can take 1 ml twice daily.
Twice a day. So if we get a symptom like easily to get fatigue,
flu,
or tired, will this help?
Of course, Baiko. That will, first of all, for example, you're feeling tired and fluish, you're getting the flu. That means that your immune system is compromised. You're getting weak. The immune system is feeling weaker. So HealthStone in this situations, first of all, the component, it has antimicrobial, antiviral, antibacterial effect. So if there's any microbes, any microorganisms that are targeting your body, HealthStone will help to combat that. Second, it will improve your immune response. Okay. It will improve your immune system. So all this effect also will make you recover your immune system, make it feel better, and you will resist getting sick, and you will feel much more stronger with that.
Okay. Jadi sehubungan dengan banyaknya pertanyaan apakah ini bisa membantu pencegahan dan pengobatan COVID-19, karena begitu banyak testimoni yang mengatakan demikian, tapi testimoni itu kan bukan satu hal yang akademik, jadi tidak bisa diklaim sebagai hal yang akademik. Tapi dari beberapa riset yang dilakukan terhadap ReaHealthTone, yang pertama yang dilakukan di University of Texas Medical Branch, dalam uji in vitro ReaHealthTone di University of Texas, ReaHealthTone terbukti dapat membunuh virus COVID-19 di lab. Kemudian sekarang juga sedang dilakukan clinical trial. Ada 2 clinical trial yang dilakukan terhadap ReaHealthTone ini. Yang pertama dilakukan di Wisma Atlet dan Rumah Sakit Hasan Sadikin. Itu clinical trial untuk membuktikan apakah Rehalton dapat membantu pengobatan, dan clinical trial di Rumah Sakit Persahabatan untuk membuktikan apakah Rehalton itu bisa membantu dalam pencegahan. Nah, dalam hasil interim dari clinical trial yang dilakukan di Wisma Atlet dan Rumah Sakit Hasan Sadikin, karena clinical trialnya belum selesai, mungkin sebentar lagi selesai, itu menunjukkan bahwa pemakaian Rehalton itu dapat mempercepat penyembuhan atau mempercepat masa di rumah sakit rata-rata 2 hari. Selain dari hasil interim yang menunjukkan bahwa masa di rumah sakitnya setelah menggunakan Rehalton rata-rata lebih cepat 2 hari, konversi PCR-nya dari positif menjadi negatif juga bisa lebih cepat. Dr. Haik, so far Rehalton is still imported from Armenia, right? Which is far away from Indonesia.
Yes.
And by air, right? Which is the transportation cost is very expensive.
Yes.
Has you have any plan that Rehalton will be produced in Indonesia?
Yes, as you mentioned, it's been an emergency situation. That's why we've been bringing Healthton from Armenia, and the cost of transportation sometimes is more expensive than the product itself. But we're luckily in this podcast, in this platform, it's the first time that we will announce that Healthton is already. We started we've manufactured the first batch in Indonesia.
Oh, now it's already produced in Indonesia.
Yes, it's the first.
Is it the local product is already in the market now?
It will be in the market after the 18th of October.
Okay.
It's produced in collaboration with Air Manchur, Kombifar.
Okay.
And of course, because we value Indonesia and the culture, we made sure that we get the halal certificate for Healthton parallel to the production in Indonesia. So as you can see here, we have already Healthton is halal certified, and that's because we understand the value of the Indonesian culture, and the product that has to be consumed orally, it's preferred to be halal certified. So that's also been taken care of. So I think from maybe next week onwards, Indonesian people can start using the Indonesian-made Healthton.
Oh, good. And it's made in Indonesia then?
Yes, sir.
So since this is already made in Indonesia, and as you mentioned, the air transportation probably as expensive as the cost of the drug itself, I mean the supplement itself. So after you produce in Indonesia, will it be cheaper?
Yes, Paiko, we're projecting to reduce the cost by around 30 to 40%.
Jadi teman-teman semuanya, selama ini Rehalton masih diimpor dari Armenia, dan itu karena Armenia jauh di Mediterania sana, itu biaya transportasinya melalui udara sangat mahal. Nah, menurut Dr. Haik, saat ini Rehalton sudah diproduksi di Indonesia dan halal, sudah mendapatkan sertifikat halal karena memang bahan bakunya semua dari natural oil, ya pasti halal, tapi sudah dikonfirmasi oleh badan yang berwajib untuk mendapat sertifikat halal. Dan yang menarik, karena sudah diproduksi di Indonesia, tidak perlu ada biaya transportasi udara lagi. Jadi mulai tanggal 18 Oktober nanti, atau mungkin telat-telat dikit lah, itu Rehalton yang produksi Indonesia ini harganya akan 30% lebih murah daripada yang selama ini diimpor dari Armenia. Jadi mudah-mudahan lebih terjangkau dan membantu kita semua untuk menjaga kesehatan dan stamina kita, dan juga membantu pencegahan maupun mempercepat pengobatan dari COVID-19. Dr. Haik, I'm told one of the cause why Rehalton can help preventing and treating COVID-19 because Rehalton do something to the ACE2. My question is it correct? And can you elaborate more? What is ACE2 and what is the ACE2 do with the COVID, and what is Rehalton can do with our ACE2 in our cell?
Yeah, so the angiotensin converting enzyme 2, it's a receptor for the virus, and it's the gate for the virus to enter the cells. So based on our research also for HealthTone and the components in the in silico models and in the docking models, we found that most of the components also have the ability to block the ACE2 receptor. So by that, it will inhibit the virus entry to the cells, and consequently, it will slow the rate of the of infection, and also it can prevent the virus transmission. So that's why when we consume Rhea HealthTone every day, it has certain type of protection that it will not allow the virus to infect the person, and that's how we get protection from HealthTone.
And what is the Rhea HealthTone do with the ACE2 actually?
Some of the components actually can block the receptor,
Okay.
and it will not allow the virus to use that receptor to enter to the cells.
Jadi teman-teman semuanya, menurut Dr. Haik, Rhea HealthTone salah satu komponennya bisa memblok reseptor di ACE itu yang ada di sel kita. Kita semua tahu bahwa salah satu pintu masuk atau mungkin satu pintu masuk dari COVID-19 adalah melalui ACE itu. Jadi dengan reseptornya diblok, itu akan mempersulit COVID-19 untuk masuk ke dalam sel kita, sehingga Rhea HealthTone bisa membantu mencegah masuknya COVID-19 di dalam sel kita. So thank you very much Dr. Haik. So I'm glad that Rhea HealthTone is already produced in Indonesia. Hopefully with the success of Rhea HealthTone in Indonesia, Rhea HealthTone Indonesian product can be exported also to other country. So it help to promote our Indonesian product to other country.
Thank you, Pek, for hosting me and for me to give me a platform to talk about benefits of HealthTone and how can we help to protect our society. And as you mentioned, I'm already trying to market the Indonesian HealthTone to Philippines, to different countries, to start exporting from here, so we can also have some economical benefit also from HealthTone. So I hope this will bring health and protection for all people here. And thank you very much again.
Thank you, Dr. Haik.
Thank you.
Demikian teman-teman semuanya, wawancara saya dengan Dr. Haik Babikian mengenai Rhea HealthTone. Terima kasih.